Hey, my name is Natalie Dumas, and I'm coming to you from Jonesboro, Arkansas as a medical technologist. I'm going to be talking to you about the different COVID vaccines available for you as a citizen to get. The first one I'm going to talk about is the Pfizer Vaccine. It is a shot given in the upper arm, and it does not contain any latex, preservatives, or eggs. It is 2 shots, and they're 21 days apart. So after you get your first dose, you'll wait 21 days to go get your second dose. It is an mRNA vaccine, and you should not get vaccinated if you're allergic to polyethylene glycol or any of the ingredients that the Pfizer vaccine contains, or if you had an anaphylactic reaction to the first dose that you had. Some common side effects that occur with all 3 of these vaccines I'm going to talk about, but they're very minor, so don't let them discourage you from getting it, is pain, redness, or swelling in the injection site. Also, you may experience tiredness, sweating, headache, muscle pain, fever, chills, or nausea. These symptoms will occur 1 to 2 days after the injection, but you may experience them more commonly after that second dose. The next vaccine I'm going to talk to you about was the second one that came out, and it is the Moderna Vaccine. It is a shot given in the upper arm, and it also does not contain latex, preservative, or eggs, and it is also an mRNA vaccine. You may experience some of those other side effects that I mentioned earlier, and this vaccine is 94.1% effective. So the Pfizer vaccine is 95% effective. Moderna is close behind with 94.1% effectiveness. The very last shot I'm going to talk to you about is the Johnson & Johnson Jansen vaccine. It is a shot given in the upper arm, and it also does not contain any eggs, preservatives, or latex. Unlike the other 2 shots, this one is only 1 shot. It is a viral vector vaccine, which differentiates it from the other 2, which are mRNA vaccines. This one is recommended in particular for people that are 18 years of age or older. Some of the more common side effects were painless swelling or redness in the injection site. And these side effects were more common in patients that were 18 to 59-year-old compared to the patients that are over 60 that get this vaccine. This vaccine is only about 66.3% effective, but early evidence shows that it might provide protection against asymptomatic infections of COVID-19. So it's still being studied and it's still being clinically trialed, but that does give hope against some of the asymptomatic infections that a patient may encounter. This vaccine was temporarily paused shortly after its release due to some women developing symptoms of thrombosis with thrombocytopenia syndrome, also known as TTS. So the FDA paused it, but as of April 23rd, 2021, the vaccine has been resumed in the U.S. But women younger than 50 should be aware of the rare risk of developing blood clots with low platelet counts after injection. Everyone should be well aware of the risks and the possible side effects of each of these vaccines, and your healthcare provider should tell you all of that information before they give you the shot. I've got all of this sources and things from the cdc.gov, so if you have any more questions, you can look there. But on a little personal note, I got vaccinated back in December with the Pfizer vaccine as soon as it came out, and unlike those side effects that I mentioned earlier, I did not have any of those besides a slight bit of swelling and pain and soreness at my injection site in my arm. But other than that, I did not have any nausea, fever, chills, any of that. So if you're on the fence about getting this vaccine, don't let the other media sources scare you into not getting it. Don't let your friends and family scare you into not getting it. You should get this because we can literally change the world. If everyone in the world gets the vaccine, or the people that are eligible to get it, we can literally slow the spread of COVID-19 completely and maybe even eradicate it. Literally, if you are on the fence about it, please do your research. Go look at the CDC's website, and please, I highly recommend you look into getting this vaccine. You know, you may be getting it to save yourself, but you can literally save so many others that may not be able to get this vaccine. This concludes my presentation. Thank you so much. Can't wait for you to get your vaccine.